there are some side effects that come with getting the COVID-19 vaccine, but there is a temporary one that could lead to a false cancer screening. And TV's Danielle Shenk spoke with some health experts and joins us now live in the studio with more on that. Danielle.
The temporary side effect causing some concern is swollen lymph nodes on the same side the vaccine was given, which has been noted by the FDA and is listed on a fact sheet commonly given at the vaccine clinics, according to the Central District Health Department.
The COVID shot itself stimulates that immune response in the body so that it can fight the disease if it should be exposed to the virus. And so while it's getting ready to fight, those lymph nodes may be enlarged for a short while, but that shouldn't be a long-term thing.
So when they have the vaccine, lymph nodes can become enlarged in 2 to 3 days, and it can present with a little bit of swelling, some nodules in the armpit.
Dr. Nowinski says if the elevated lymph nodes don't go down after about 4 to 6 weeks, you should consult your doctor.
The most likely place that people would notice would be up in the jaw area, just under the jaw, or maybe around like a necklace around the neck. Sometimes you can feel lymph nodes there. And then there are always lymph nodes that can be palpated under the arm by a healthcare provider.
For those around your neck, Anderson says you can do a quick self-check.
So normally, if you just feel right under your jaw, normally that's a very smooth, soft area. If there's a lymph node that's starting to enlarge, you just can kind of feel a lump in there. And some of those lumps can get pretty large.
The reason swollen lymph nodes may be concerning is because they can be a sign of cancer.
Breast cancer develops in the breast and then spreads to the lymph nodes, and so that will actually show up as some enlargement of the lymph nodes. It's unusual to have that finding and be the only finding without having something within the breast tissue.
To reassure patients, Dr. Nowinski says they let them know this is a normal response from the immune system after getting vaccinated.
I'm reading a lot of mammograms that patient has had the vaccine, and the lymph nodes are normal or just a little bit enlarged. I have yet to have to call someone back for it, but it's important to let the patient or let the mammography technologist know when they come in that they've had the vaccine and on which side.
Since this is a temporary side effect, Dr. Nowinski says you shouldn't delay your cancer screenings.
Annual mammography saves the most lives, and so any delay in having a mammogram could be a big deal, and it could let a cancer grow in there. So it's important that there's no delay in getting your annual mammogram.